Okay, it is Thursday, September 2nd. We are going to start on page 39, Introduction to Anatomy. The human body contains multiple organ systems. An organ system is a collection of body parts depending on one another to achieve a mutual objective. The following organ systems will be addressed briefly here and in greater depth in subsequent coding chapters as relevant. Integumentary, musculoskeletal, cardiovascular, lymphatic, respiratory, digestive, urinary, reproductive, nervous, organs of sense, eye and ear, endocrine, hematologic, immune, anatomical positions and planes. For physicians, nurses, and other healthcare personnel to communicate accurately, they must use a standard form for body directions and orientations. This is achieved by using anatomical directions and planes. The standard body position is the anatomical position. The anatomical position is an upright, face forward position with the arms by the side and palms facing forward. The feet are parallel and slightly apart. Based on the anatomical position, the following directional terms are pertinent to medical documentation: anterior, ventral, toward the front of the body; posterior, dorsal, toward the back of the body; medial, toward the midline of the body; lateral, toward the side of the body; proximal, nearer to the point of attachment or to a given reference point; distal, farther from the point of attachment or from a given reference point. For example, if someone had an injury and they said that it was distal to their shoulder, that means it would be going down toward the hand. So if it was on their forearm or something and they said it was distal from the shoulder, then it would be toward the hand or forearm. Superior, cranial, above, toward the head; inferior, caudal, below, toward the lower end of the spine; superficial, external, closer to the surface of the body; deep, internal, closer to the center of the body; supine means lying face up; prone, lying face down. And you do have these planes and directions in the front of your coding book. So make sure that you write any additional directional terms or body planes or anything referencing those. Add those terms to your pictures that you have in your book. For radiological studies, the body is often cut along a flat surface called a plane. Frequently used planes include sagittal, cuts through the body from front to back and divides the body into right and left sections; mid-sagittal, cuts through the midline of the body from front to back and divides the body into equal right and left sections; frontal or coronal, cuts at a right angle to the midline from side to side and divides the body into front anterior and back posterior sections; transverse, horizontal, axial, cuts horizontally through the body and separates the body into upper, superior, and lower, inferior sections. Application to documentation. Indication: left vocal cord paralysis, CT neck without contrast. Technique: axial CT cuts were obtained from the top of the orbits down to the thoracic inlet using 100 cc of IsoView 300. 13 millimeter axial CT cuts were also obtained through the larynx; sagittal and coronal computer reconstruction images were also obtained. Use of anatomical planes, axial, sagittal, and coronal. Explain the types of images obtained. Structure of the human body. The structure of the human body is divided into 4 categories: cells, tissues, organs, systems. Each structure is a highly organized unit of smaller structures. Cells. The cell is the basic unit of all living things. Human anatomy is composed of cells varying in size and shape according to function. Cell membrane forms the boundary of the cell. Cytoplasm makes up the body of the cell. Nucleus is the small round structure in the center of the cell. Chromosomes are in the nucleus of the cell. They contain genes that determine hereditary characteristics. Tissues. Tissue is a group of similar cells performing a specific task. Muscle tissue produces movement. Nerve tissue conducts impulses to and from the brain. Connective tissue connects and supports various body structures. Adipose fat and osseous bone. Epithelial tissue is found in the skin and lining of the blood vessels, respiratory, intestinal, urinary tracts, and other body systems. Organs. Organs are two or more kinds of tissue together performing special body functions. For example, skin is an organ composed of epithelial, connective, and nerve tissue. Systems. Systems are a group of organs working together to perform complex body functions. For example, the nervous system is made up of the brain, spinal cord, and nerves. Its function is to coordinate and control other body parts. Medical terms related to cells and tissues. Cell membrane surrounds and protects the individual cell. Nucleus, small round structure within the cell containing DNA and RNA. Chromosome, linear strand made of DNA carrying genetic information. Cytology, study of cells including formation, structure, and function of cells. RNA, contained within the nucleus, is transcribed from DNA by enzymes and plays a crucial role in protein synthesis. Gene, specific segment of base pairs and chromosomes, functional unit of heredity. Mitosis, cells divide and multiply to form two cells. Body cavities. The body is not a solid structure. It has 5 cavities, each of which contains an orderly arrangement of internal organs. Dorsal cavity includes cranial cavity, the space inside the skull or cranium containing the brain. Spinal, vertebral canal cavity, the space inside the spinal column containing the spinal cord. Ventral cavity includes thoracic or chest cavity, the space containing the heart, lungs, esophagus, trachea, bronchi, and thymus. Abdominal cavity, the space containing the lower portion of the esophagus, the stomach, intestines, excluding the sigmoid colon and rectum, kidneys, liver, gallbladder, pancreas, spleen, and ureters. The abdomen can be divided into 4 sections: right upper quadrant RUQ, left upper quadrant LUQ, and right lower quadrant RLQ, and left lower quadrant LLQ. For example, the spleen is located in the left upper quadrant of the abdomen. Pelvic cavity, the space containing the urinary bladder, certain reproductive organs, part of the large intestine, and the rectum. Membranes. Membranes line the internal spaces of organs and tubes opening to the outside and line body cavities. There are 5 types of membranes: mucous membranes, serous membranes, synovial membranes, meninges, and the cutaneous membrane. Mucous membranes. These line the interior walls of the organs and tubes opening to the outside of the body, such as those of the digestive, respiratory, urinary, and reproductive systems. These membranes are lined with epithelium and are involved in absorption and secretion. The mucous membrane is composed of epithelium overlaying a layer of connective tissue called lamina propria. In some instances, the lamina propria rests on a 3rd layer of smooth muscle cells. Not every mucous membrane secretes mucus. Serous membranes. These line cavities, including the thoracic cavity and internal organs, example, heart. They consist of a layer of simple squamous epithelium overlaying a layer of loose connective tissue. Serous membranes support internal organs and compartmentalize the large cavities to hinder spread of infection. The serous membranes are named according to their organ associations. The lungs are covered by pleura and the heart is covered by pericardium. The serous layer also lines the abdominal cavity and is known as the peritoneum. Synovial membranes. These line joint cavities and are composed of connective tissue. They secrete synovial fluid into the joint cavity. This lubricates the ends of bones so they can move freely. Meninges. Meninges are composed of three connective tissue membranes found within the dorsal cavity and serve as a protective covering of the brain and spinal cord. The meninges from outer layer to inside layer are dura mater, arachnoid matter, and pia mater. Cutaneous membrane. This membrane forms the outer covering of the body and consists of a thin outer layer of stratified squamous epithelium attached to a thicker underlying layer of connecting tissue. The cutaneous membrane is skin. Connective tissue support and connect tissues of the body. Connective tissue is divided into four general groups: connective tissue, proper, cartilage, bone, and blood. Integumentary system. The largest organ system in the body is comprised of three structures: skin, hair, nails. These structures work together to provide the following functions within the body: protection from injury, fluid loss, and microorganisms. Example: bacteria, virus, fungus, yeast. Temperature regulation, fluid balance, excretion, sensation. Skin. Two layers make up human skin, dermis and epidermis. Each layer and its components are listed below. You should be familiar with the various layers and be able to apply this knowledge when choosing the appropriate CPT code. You also have a picture of the skin in the front of your coding book. And you can add any additional information to that diagram as needed. Epidermis. The epidermis composed of 4 to 5 layers depending on location, called stratum. The stratum lucidum layer is normally found only on the palms of the hands and the soles of the feet. The various strata are stratum corneum, also called the horny layer, outermost layer; stratum lucidum, palms and soles, clear layer; stratum granulosum, granular layer of cells. It contains two types of granules: keratophyllene granules and lamellated granules. Stratum spinosum, composed of prickle cells that are interwoven for protection. Stratum basal, stratum germinativum, deepest of the 5 layers and made of basal cells. Dermis. The dermis is located deeper, just under the epidermis. It has 2 strata: stratum papillaire, thin superficial layer interlocked with the epidermis, and stratum reticulaire, thick layer of dense irregular connective tissue. The dermis contains many important structures, nourishing and innervating the skin: vessels carrying blood and lymph, nerves and nerve endings, glands, hair follicles. The dermis lies on the subcutaneous, beneath the skin tissue. The subcutaneous tissue is known as the hypodermis and is not considered to be a layer of the skin. That is also a test question. So remember that the hypodermis is not considered to be a layer of the skin. The subcutaneous tissues are mostly composed of fatty or adipose tissue, plus some areolar tissue, loose connective tissue consisting of a meshwork of collagen, elastic tissue, and reticular fibers. The hypodermis serves to protect the underlying structures, prevent loss of body heat, and anchor the skin to the underlying musculature. The fibrous connective tissue, referred to as superficial fascia, is included in this layer. Understand the stratification of the tissue layers and the structures lying within when coding for surgical procedures throughout the body, and most particularly for those procedures performed on the integument. When applying CPT codes found in the 10,000 section, you must know on which layer the provider worked. Application documentation. Narrative. After prone positioning and IV sedation, the left upper back was prepped and draped in a sterile manner. Local anesthesia, 1% lidocaine, and bicarbonate were used. A vertical incision was made over the mass and extended. Deep in the subcutaneous tissue, over muscle fascia, was an 8 centimeter lipoma with a lot of lobulations between skin ligaments, and these were all progressively divided to excise the entire mass, including a portion of the muscle fascia. An oblique drain was positioned through an inferior stab wound and secured with ethelon. All bleeding was controlled with cautery. The subcutaneous tissue was approximated with Vicryl, and the skin was approximated with intra-articular vicryl suture. Steri-strips and dressings were applied. The patient was awakened and moved to the recovery room in satisfactory condition. There were no complications. Blood loss was minimal. In the above documentation, understanding the depth of the procedure, for example, which layers of tissue are involved, is necessary to select the appropriate procedure code. Medical terms relating to skin: allograft, a graft transplanted from one person to another who is not genetically identical, also called an allogenic skin graft. Autologous, obtained from the patient as both the donor and recipient. Cutaneous, pertaining to the skin. Dermatology, the study of skin. Dermatologist, physician specializing in diseases of the skin and subcutaneous tissue. Decubitus, pressure ulcer, bed sore. Ecchymosis, condition in which blood seeps into the skin, causing discoloration. Hypodermic, pertaining to under the skin. Intradermal, pertaining to within the skin. Jaundice, yellowness of skin. Melanin, pigment giving color to the skin. Melanoma, pigmented malignant tumor of the skin, the most dangerous form of skin cancer. Pediculosis, infestation with lice. Percutaneous, through the skin either by absorption or by needle puncture. Pruritus, severe itching. Subcutaneous, pertaining to below the skin. Tinea, ringworm, a fungal infection of the skin. Transcutaneous, penetrating, entering, or passing through the skin. Trichomycosis, fungal infection of the hair. Urticaria, raised wheals or hives on the skin with itching. The trichomycosis is also a test question. Also, this urticaria is a test question. So if you don't know what those words are, please add those to your definitions or somewhere in your notes in your CPT book so that you will know what those are. Hair. By 22 weeks, a developing fetus has its lifetime supply of hair follicles. On average, the body has 5 million follicles, with the greatest concentration, approximately 1 million, on the head. Follicles are never added during life. As the size of the body increases, density of hair follicles on the skin decreases. Hair on the scalp grows approximately 0.3 to 0.4 millimeters per day, or approximately 6 inches per year. Hair has two separate structures, follicle and shaft. The follicle contains several layers. At the base is a bulb-like projection called a papilla. Capillaries nourish the bulb. Cells in the bulb divide every 23 to 72 hours. Inner and outer sheaths protect and mold the growing hair shaft surrounding the follicle. The inner sheath extends at the opening of the sebaceous gland, which secretes sebum. It may pocket, causing benign lesions on the scalp. Report removal of these benign cysts using CPT codes 11400 through 11471. Muscles called the erector pili attach to the outer sheath and cause hair to stand up when the muscles contract. The shaft is composed of keratin in 3 layers: the medulla, cortex, and cuticle. Pigment cells in the cortex and medulla give hair its characteristic color. Nails. The fingernail is made of keratin, acting as a protective plate and as a counterforce to the fingertip to increase sensory input of touch. Nails grow all the time, but growth slows with age and poor circulation. Fingernails grow approximately 3 millimeters per month. Toenails grow more slowly at approximately 1 millimeter per month. The nail is divided into 6 parts: the root, nail bed, nail plate, epinkymum, cuticle, parenchyma, and hyponkymum. The root or the germinal matrix lies beneath the skin behind the fingernail and extends several millimeters into the finger. The root produces most of the volume of the nail and the nail bed. Its edge is the white crescent-shaped structure called the lunula. The nail bed, called the sterile matrix, extends from the edge of the lunula to the hyponkymum. The nail bed contains the blood vessels, nerves, and melanocytes, melanin-producing cells. The nail plate is the actual fingernail, made of translucent keratin. Blood vessels underneath give the nail its pink appearance. The grooves along the inner length of the nail plate anchor the nail to the nail bed. The cuticle, also called the epinkymum, lies between the skin of the finger and the nail plate, fusing the skin of the finger to the nail plate. The parenchyma, also known as the parenchymal edge, is the skin overlying the nail plate on its sides and is the site of hangnails, ingrown nails, and an infection of the skin called parenchyma. The hyponkymum is the junction between the free edge of the nail and the skin. Medical terms related to hair and nails: alopecia, loss of hair; follicles, specialized structures required for hair growth; hair follicles, sac holding the root of hair fibers; hair papilla, knob-like indentation at bottom of hair follicle containing the blood supply to hair root; lunula, little moon area of nail; nail body, visible part of nail; nail bed, skin below the nail; epidermis and dermis, sterile matrix. Onychitis is inflammation of the nail matrix. CPT codes in the 10,000 range address procedures and services relative to the integumentary system. Okay, please do section 2.2. I'm also going to add those to our Google Classroom so that you can check your answers. All right.